Good afternoon, everybody. Welcome to the City of Toronto COVID-19 media briefing for Monday, May the 25th, 2020. Joining us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mr. Mayor.
Well, good afternoon and thank you, Brad. And I'd like to start, Chief Pegg will have more to say about this, but I want to start by acknowledging this is Paramedic Services Week. As we all know, paramedics devote their lives to keeping our city and its residents safe, and this is a week in which we can recognize, as we should every week, but this is a special week to recognize the contributions of these vital healthcare professionals. Every day, paramedics, a group of our frontline heroes, go out into our communities to provide life-saving service to our residents as they work to maintain a safe and healthy city. This year's theme of Paramedics Week is Pandemic, Paramedics on the Front Line, which speaks accurately to the important role that paramedics play on the front lines of the healthcare system during a pandemic. So I want to thank our paramedics for all that they do in protecting our city and its residents, and acknowledge the exceptional service we receive from our Toronto Paramedic Services, not just during this pandemic, not during just this week, but each and every day. Today, we are moving ahead with our active TO plan to expand and connect our city's bike network. This plan, which goes to City Council on Thursday, will create 40 kilometers of expanded and accelerated bike routes across the city. We know our streets are going to look different in the wake of COVID-19. Right now, we are seeing car traffic and pedestrian traffic at an all-time low, while bike traffic has stayed about the same. We know that will change in the coming weeks and months. We will need more bike infrastructure for people who want to get around in a safe and healthy way. We will need more space set aside for walking so people can keep their distance. We will need quiet streets so that people are safe. And I am determined to see us have more patio space for our restaurants and bars, both because it will improve the quality of life in appropriate locations and in neighborhoods, but also because it will help one of our hardest hit industries. The report released today moves ahead with an expansion of our bike network in a quick and common sense way. I want to thank the many councillors who have already voiced their support for the projects in their wards today. They understand that we have to take action now to prepare for the economic restart and recovery ahead. We have to give people options to get around our city in a post-COVID-19 world. More options bring with them a number of health benefits for residents. These initiatives will help businesses recover sooner by helping customers and employees get where they need to go safely. It will also help our frontline workers get to where they're needed most, since many of the routes are near or connected to hospitals, clinics, doctors' offices, and other services. Along with speeding up the existing projects we had planned for this year, staff have answered our call to come forward with around 25 kilometers of new and temporary bikeways this year, for a total of approximately 40 kilometers of on-street cycling lanes approved for accelerated installation early in the summer. We are ready to create more safe space for cyclists and pedestrians all around Toronto, and we are well underway with that work. Well-planned cycling routes, including along subway lines, will provide a much-needed relief valve for the transit system, support our Vision Zero road safety plan, and allow people to be physically active while respecting physical distancing guidelines. Most of the proposed initiatives in this report are quick start installations that safely and temporarily repurpose curb lanes using paint and signage and temporary barricades. This is similar to initiatives we've seen in cities around the world as they lift lockdowns and reopen their economies. All the routes are based on professional staff advice on what makes sense to do right away and what is achievable. This is not about ideology. It is about doing everything we can where it makes sense to make sure that people can get around in a safe and healthy way going forward. In that way, it is very similar to the initiatives being taken in other cities. So the report seeks council authority to accelerate permanent separated bike lanes on Bloor Street West from Shaw Street to Runnymede Road, extending to the west the permanent bike lanes on Bloor from Spadina to Shaw, previously approved by City Council, installed now for some time. It also proposes temporary cycling projects as part of active TO on Bloor Street from Avenue Road to Sherbourne Street, Dundas Street East from Sackville Street to Broadview Avenue, University Avenue, Queen's Park Crescent from Adelaide Street to Bloor Street West, Huntingwood Drive from Victoria Park Avenue to Brimley Road from Kingston Road to Lawrence Avenue, Danforth Avenue from Broadview Avenue to Dawes Road, Bayview Avenue from River Street to Rosedale Valley Road, River Street from Gerrard Street East to Bayview Avenue, Wilmington Avenue from Finch Avenue to Shepherd Avenue, and Faywood Boulevard from Shepherd Avenue to Wilson Avenue. The proposed plan includes flexibility so that the new bike lanes can be adjusted based on changing traffic volumes, which we will be measuring nonstop in many different ways, including the very latest technology, as we have done previously. And it will also be responsive in terms of that flexibility to the evolving needs of residents and businesses in the wake of the pandemic. The more permanent Bloor Street West extension to Runnymede has been discussed and planned for some time now, and it is exciting to be in a position to deliver that project sooner. Among the temporary bike lanes in this report, the first 3 installations would be along Bloor Street East, University Avenue, Queen's Park Crescent, and Dundas Street East, providing much-needed connectivity along those routes that will have a direct impact on the reliance on vehicles and provide a safety valve for the TTC. The approach to Danforth Avenue will be one that is consistent with the ongoing Danforth study started well before the pandemic. In the case of this project, city staff are recommending a complete streets approach as part of the city's focus on Main Street revitalization in the wake of COVID-19. Staff are proposing to create more public space, more patios, make a more beautiful street, and pilot active transportation infrastructure on the Danforth from Broadview Avenue to Dawes Road. I want to reassure businesses that city staff will be reaching out to work with the local BIA offices to finalize all designs well before they're installed. This feedback will be critical before any changes are made. And we want these lanes to work for everyone, so we will continue to work with local councillors, with residents, and with local businesses to address their concerns. Bikes do bring business. In an era where people more than ever want to support local business and where we want those local businesses to get back on their feet and to thrive again, our push for more space for pedestrians and cyclists and patios will, I believe, make a positive difference for those businesses and for those neighborhoods. Our experience with the Bloor bike lane showed that when done right, it contributes to increased spending and increased business. And in fact, many of the local businesses who were initially hesitant became strong supporters of the Bloor Street bike lanes for just that reason. We will have more to say on a broader city plan for expanded patios in the coming days. I believe restaurants and bars will need more space outside in the wake of COVID-19, and we have staff working on a plan. One other thing I would like to report to you on today is I convened once again a meeting of the Greater Toronto and Hamilton area mayors and chairs to discuss the ongoing response to the COVID-19 pandemic. The mayors and chairs remain united in confronting this virus in our communities and making sure we do everything we can on as cooperative a basis as we can to help residents and businesses get through this emergency, and frankly to help each other get through this emergency. This group is also united in its advocacy to the federal and provincial governments for municipalities to be supported when it comes to the costs of confronting COVID-19 in our communities and the need to properly restart our economies with a degree of financial stability. We're encouraged that the provincial and federal governments have begun discussions about supporting municipalities, but we need for them to follow through with a financial commitment to municipalities across Ontario, in the GTA, and for that matter across the country as soon as possible. We are particularly grateful for the leadership roles played in these discussions by Premier Ford, who has been working with his provincial counterparts. Now, we are very fast approaching the time where the financial commitment I made reference to is needed from these governments. Otherwise, if support is not received, major service reductions would be necessary in all of the GTA municipalities. On another related matter, while we all want the reopening and restart of our provincial economy to happen as quickly as it is safe to do so, the mayors and chairs agreed that we must all proceed very cautiously towards the next stage of the provincial framework. We are committed to working with the province and with our own public health units, all of us together, across Ontario to help shape Stage 2 of the provincial government's own framework and ensure that it works for local communities based on local public health conditions, and to ensure to the greatest extent possible that rules and regulations are consistent across the region when it comes to the actual rollout. We welcome as well the province's commitment to increased COVID-19 testing and the announcement over the weekend of a more comprehensive approach to testing. We all want to see more testing done in the coming weeks so it can help guide our public health officials as we work towards moving further into economic recovery and making sure at all costs that we keep people healthy. And we want to encourage as well that residents should get tested if they believe, of course, that they have COVID-19 or symptoms of COVID-19. Now, while we support encouraging our residents to get tested in those circumstances, it is crucial that prior to the planned implementation of this new strategy, local input is sought and received from hospitals and laboratories and local public health officials with respect to available capacity, including proper funding, to ensure the success of a provincial campaign to increase testing. This was a message I received from the GTA mayors when we met earlier today. I want to thank the GTHA mayors and chairs for their ongoing commitment to cooperation and to working together to make sure we get through this pandemic. Working together, something that has been and will continue to be fundamental to our ability to wrestle this virus to the ground. Now I will ask Dr. Eileen de Villa to give her report for today.
Thank you, Mayor Tory, and good afternoon. Today, there are 177 new COVID-19 infections in Toronto. To date, 7,509 people have recovered, an increase of 112 since yesterday. For more detailed information on COVID-19 in our city, I would ask that you please visit our website. I understand that there are questions regarding people who were present at Trinity Bellwoods Park on Saturday and what advice I might have for these individuals. If you were one of these people, it is possible that you may have been exposed to someone who has COVID-19 infection, but with little or no symptoms, especially if you are within 6 feet of others, having face-to-face conversations. Because of this, it is important that you monitor yourself carefully for COVID-19 symptoms for the next 14 days. If you should develop any symptoms of COVID-19, please go and get tested immediately. While you are self-monitoring for symptoms for the next 14 days, I would ask that you be extra diligent with hand hygiene. In addition, please make sure you keep a physical distance of 6 feet from others, and if you are not able to do so, please make sure you wear a non-medical mask to prevent the spread of any germs that you may have to others. I would ask that you also please consider avoiding contact with people who are most vulnerable for serious illness with COVID-19 or complications of COVID-19, such as elderly people and those with chronic health conditions. I had the opportunity to discuss this matter with the Chief Medical Officer of Health and the Associate Chief Medical Officer of Health earlier this afternoon, and we all agree on this approach. On another note, I have also recently learned that our data suggests that it is taking, on average, almost 5 days from the time someone presents with symptoms of COVID-19 to when they actually get tested. This is very concerning. By way of reminder, COVID-19 symptoms can include fever, cough, difficulty breathing, unexplained fatigue, headache, sore throat, runny nose that doesn't fit with the pattern of your typical seasonal allergies, loss of taste or smell, nausea, vomiting, diarrhea, or abdominal pain. If you or a family member are experiencing one or more of these symptoms, please go and get tested. You need to isolate until you get tested as well. If you live with other people in your household, please inform them that you are experiencing symptoms of COVID-19 and that you are getting tested. People you live with should monitor themselves for COVID-19 symptoms and get tested should they develop any of those symptoms. Even if you are not worried about becoming sick yourself, we all need to remember that our actions have an impact on other people in our community. You may feel healthy and you may have no symptoms, but you can still have COVID-19 and be contagious. While you are out with your friends, you can unknowingly spread the virus. It can then spread further, possibly to a more vulnerable person who is at risk of serious complications of COVID-19 or at risk of dying. This could be anybody, your friends, your neighbors, your parents, your loved ones. I believe each and every one of us wants to do the right thing and keep each other safe. So while it may be difficult, especially as we head into the summer, we must continue to practice physical distancing. This is the only way we can get to a time when we can all safely connect with our friends and our families in person. On another topic, I wanted to take a moment to address the hot weather currently forecasted for our city. Please remember that hot weather can be dangerous to your health. Impacts range from relatively mild symptoms like heat rash through to more serious ones like heat exhaustion and heat stroke. Heat-related illness is preventable, and there are actions you can take to stay safe and keep cool. Make sure you stay inside during the hottest part of the day and keep hydrated. I encourage everyone to call in with and check on vulnerable friends, relatives, and neighbors, especially elderly residents living alone, to ensure that they are staying hydrated and keeping cool. You can learn more and get tips to beat the heat at toronto.ca/keepcool. I do encourage residents to get active outside and enjoy the nice weather and some fresh air. We know that physical activity is important for our overall health and well-being. This is why I'm so pleased to see more space being created through active TO so that our residents can get outside to exercise in a way that is safe. Increasing opportunities for daily physical activity has a positive impact on our physical and our mental health and can significantly reduce our risk of a number of chronic diseases and some cancers. Active transportation is more significant than ever as a result of COVID-19, and whether you walk, jog, or cycle, I encourage everyone to take advantage of these opportunities while the weather is nice. Please keep hydrated by drinking lots of water when you go outside, even before you feel thirsty. And just a reminder, at this time, you should only be going outside with members of your household. Expanding our cycling network through active TO will help protect and promote good health in our city, not only now, but for years to come. I look forward to implementing these important initiatives to keep people healthy and mobile, now and in the future. While we know that the risk for becoming infected with COVID-19 while passing someone on the street or walking a trail or bike path is low, I would ask that you give each other space. Please step aside or pass others quickly when you're out and about so that we can all create more space for all of us to be active. I want to stress again that to move forward, we need you to continue to do your part to reduce the spread of COVID-19. Please continue to practice physical distancing at all times, and please continue to take care of each other. I'll now hand it over to Chief Pegg to deliver his remarks.
Excuse me. Thank you, Dr. Davila, and good afternoon. Today, I'll focus my remarks on saying thank you to our paramedics. As Mayor Tory acknowledged, it is Paramedic Services Week in Canada, and it is my honor to thank and acknowledge Chief Gord McEachern and the amazing women and men of Toronto Paramedic Services. Paramedic Services Week is held annually to recognize the contributions of these vital public servants who help maintain safe and healthy cities across the country. As the largest municipal paramedic service in Canada, the staff of Toronto Paramedic Services, including both those on the front lines and behind the scenes, ensure that when any member of the public calls 911 for medical assistance, they receive superior and compassionate paramedic-based health care 24 hours a day, 7 days a week. Paramedic Services Week is our time to recognize the paramedics, emergency medical dispatchers and call takers, operational support staff, and management staff. Each one of these employees is an integral part of our organization and contributes to maintaining the trust and confidence of the residents of the City of Toronto, especially during this pandemic. Our paramedic service is without a doubt one of the best. I'd like to take just a few moments to share a few service highlights with you. Toronto's Central Ambulance Communications Centre is an internationally accredited centre of excellence. The Community Paramedicine Program is an innovative program focused on health promotion and injury prevention, and actively works to connect vulnerable patients to the most appropriate healthcare options. Toronto Paramedic Services maintains an accredited advanced care paramedic training program and also delivers primary care paramedic training in partnership with Toronto Employment and Social Services. As we all know, COVID-19 has presented paramedic services with many challenges. It is through the tireless hard work and dedication of staff that Toronto Paramedic Services will continue to support our communities through these difficult times. On a personal note, I have the privilege of witnessing firsthand the exceptional care and service that our paramedics provide each and every day. This, of course, includes leading-edge pre-hospital care for our residents, as well as providing critical care and support to our police officers and firefighters on emergency scenes every day in the performance of their duties. Our paramedics are vital members of our HUSAR and public order teams, and as we have all witnessed, are on the very front lines in responding to COVID-19. On behalf of each of us, I extend my sincere thanks and congratulations to our paramedics for all they do each day. Finally, our EOC teams had a busy weekend as we continue to both plan for and respond to issues as they arise. Each of our essential city services continue to operate without interruption. Our PPE levels continue to remain stable, and we're working hard to proactively manage both PPE inventories and the supply chain. In closing, I remind everyone that toronto.ca/COVID-19 is the best source for up-to-date information on COVID-19 in Toronto. And for more information on active TO initiatives, we encourage you to visit toronto.ca/active-TO. Thank you.
Thank you, Chief. We'll go to questions on the line from staff. For reporters, so you know, we have Barbara Gray from Transportation Services, Marianne Bedard from Shelter Support and Housing, Paul Raftis from Senior Services and Long-Term Care, and Carlton Grant from Municipal Licensing and Standards. First question is Matt Bingley from Global News. Matt, go ahead.
Hi, Good afternoon. Dr. Davila, I was speaking with a doctor from Michael Garron Hospital this weekend, and he expressed concerns with the amount of contact tracing that Toronto Public Health is doing, specifically that there is no contact tracing between 8 p.m. and 8 a.m. Now, where opening the city again is really dependent on speedy contact tracing, I'm wondering if you think that this gap in time there is acceptable and whether you think that you have enough resources.
So Matt, thanks for the question. We're constantly reassessing and assessing our resources to make sure that we're doing the best we can in terms of the COVID-19 response. And we completely appreciate and support the notion that timely case and contact tracing is an important element of that response. But given that, we're in public health, this is not something that's unique to COVID-19, as you know. This is actually case and contact tracing is one of the foundations of communicable disease prevention and control, one of the things that we do on a daily basis. And in our experience, we find that in order to actually reach people and have substantive conversation with them, we do find that the hours that we work, that 8 to 8, particularly in this scenario, are the hours where we're actually able to make successful connections with people and make good use of the resources that we have available to us. So I can assure you that we are absolutely keen and concerned about making sure that case and contact tracing is happening in a timely fashion, which is why we are doing what we're currently doing now with the knowledge that we have based on case and contact tracing experiences over many, many years and over a wide variety of communicable diseases.
Okay, and you were also speaking about that gap in time where people were developing symptoms before the time they get tested. Can you just tell us about how difficult that actually makes contact tracing when you have that 5-day head start?
Yeah, so what we did notice, we're looking at our data, and of course, as part of trying to improve case and contact tracing and overall constantly trying to improve the COVID-19 response, because that's professional appropriate practice, we observed the data and we happened to see that what we're finding is that people are taking as much as 5 days, on average I should say 5 days, from the time that their symptoms are developing until they actually get tested. And that's valuable time that we would like to see shortened. That's why I've made the remarks that I've made today and will continue to deliver this important message. And that important message is simply this. If there is a list of symptoms of COVID-19, I won't repeat the whole thing right now, but certainly it is available on our website. If you or one of your family members has any of those symptoms, they should go and get tested for COVID-19. While they're in the process of so doing, I would ask that they isolate, minimize contact with others to try to reduce the spread, but I would urge people who have any of those symptoms of COVID-19 to seek appropriate testing as soon as possible, limit contact with others, and initiate that process so that we can reduce the spread of this disease in our community as quickly as possible.
Okay, thank you. We'll go to Miriam Adaya now from Radio Canada. Go ahead, Miriam.
Mayor Tory, what is the city's plan to avoid the kind of situation we saw this weekend with Trinity Bellwoods? Whether it's in parks or on Queens Quay West, there's a lot of people by the lake during weekends. Are you considering placing, for instance, social distancing circles like we've seen in Brooklyn or San Francisco, for instance?
The idea of social distancing circles is under active consideration by our staff, as are a host of other matters, and we've asked them to come back with a plan that includes considerations of policing and enforcement. It includes considerations of how you can help people to physically distance themselves in parks and other public spaces. And of course, we continue to make more public spaces available through the active TO program, so that I would expect in the next couple of days, because that's what I've requested, that we will have a report from our officials from all different aspects of the city on how we can make things better and be better in a position to deal with things like this if they come up going forward in the nice weather and generally.
And for Dr. Davila, why not ask people to get tested like Doug Ford did a couple of hours ago?
Well, you know, I think the issue with getting testing now is that if we're talking about potential exposures from Trinity Bellwoods, which was just on Saturday, keep in mind that the way this disease works is that there is an incubation period. So a period of time between when somebody might have been exposed or was exposed to COVID-19 before they actually then start to develop a response and to develop symptoms associated with that. So very briefly, the challenge is that if the testing is done at the wrong time, you run the risk of actually, you know, getting a negative test, and it's just a test that's simply too soon in order to be able to appropriately diagnose or pick up the potential for COVID-19 infection. So it's always in the timing. And, you know, that's why I'm actually also recommending you get more focused testing, better use of your resource right now when you look at symptoms. Let's look at the symptoms that are there. If you have one or more of those symptoms of COVID-19, by all means, go out and get tested. For those who are at Trinity Bellwoods, I would encourage self-monitoring. Monitor yourself carefully for signs and symptoms of COVID-19 over the next 14 days. And if any of those symptoms should develop, then I would go and get tested.
Okay, thank you. We go to Brian Passafume now from the Toronto Sun. Brian?
Good afternoon, everybody. My first question is for the mayor. Just last week, you presented a pretty grim economic picture of the impact that this pandemic is having on our city, specifically talking about closing down subway lines and eliminating hundreds of beds relied upon by our city's most vulnerable. My question is, in light of this, can you explain how council can justify spending millions of dollars on expanding the bike network when we face the really very real possibility of closing the door on our city's seniors, those experiencing homelessness and those battling addiction?
Well, first of all, there's a profound difference between spending on capital, investing in the future for investments that will last the city for many, many years, at the same time as addressing public health and safety issues, and the money we desperately need help with on the operating side, which actually fund the ongoing provision of services to various groups of people in the city. The amounts that are provided for to accelerate the bike lane, and this is all acceleration of bike lane projects as opposed to brand new ones that we've come up with, are provided for in many cases in the budget. We're receiving some monies from other governments. It's not entirely at the expense of city taxpayers. And we believe these represent good investments in the long-term infrastructure of the city, given changing transportation patterns and given the need we have right now to make sure people can safely and in a good, healthy manner get around the city with the physical distancing requirements taken into account. And so I can just say that the help that we've asked for from the other governments is specifically on operating funds, because we don't want to take away from any of our capital investments in affordable housing, in transit, in other forms of active transportation, in water and sewage infrastructure, that we need to make those kinds of investments for the future, for the long-term future, replacing, yes, 143-year-old water mains, adding transportation infrastructure where it's needed, yes. And those are long-term investments that have been postponed for far too long. The other kinds of shortfalls we have are operating shortfalls, which are quite different in nature.
Okay, thanks. My second question is, after your, just sort of expanding on what Dr. Davila was talking about, after your visit to Trinity Bellwoods Park on Saturday evening, will you be taking her advice and self-monitoring for symptoms?
Of course. You know, there's a lot of opinions floating around in a lot of these areas to do with what people should do, that either at Trinity Bellwood Parks or a host of other places. You know, there's more opinions than you'd have at a medical convention. I accept the advice unreservedly of Dr. Davila, our medical officer of health. Fortunately, that advice in terms of self-monitoring, being careful with physical distancing, being careful around vulnerable populations, is concurred in by I think both the Chief Medical Officer of Health for Ontario and the Associate Chief Medical Officer of Health for Ontario. So I feel very comfortable, as I would in any event, and as I have throughout the management of this emergency, to accept her advice, which I will continue to do going forward. And I will, of course, engage in that self-monitoring and the other aspects of care that have been recommended.
Okay, thank you. Next question is Haley Cooper from News Talk 1010. Haley?
Thank you. My question is for Mayor Tory. I just want to piggyback on Brian's question and the comment by Premier Ford this afternoon, asking everyone who was at Trinity Bellwoods Park over the weekend to go out and get tested. And then this afternoon, Dr. Barbara Yaffe said that the testing wasn't really necessary, but those people should self-isolate for 14 days. And now we've heard from Dr. Davila saying they should just self-monitor and stay away from people considered high risk. So I guess with all the concerns about asymptomatic people transmitting the virus to other people, would you consider, Mayor Tory, getting tested, let's say, in 14 days? And was there any consideration about self-isolating?
I'll repeat this again. I will unreservedly accept the advice rendered by our medical officer of health, Dr. Eileen Davila. She's given that advice, which suggests that I should not get tested now for reasons she's explained today. It has suggested further that I should self-monitor, which I will do. I've basically been doing that in any event because obviously you watch for symptoms that you would have, as anybody should be doing. And if that advice changes in any way, I will accept that advice from Dr. Davila. And my understanding is, a bit contrary to what you said, that the advice actually given by the provincial medical officers of health was the same. Self-monitor as opposed to self-isolation, but I will accept the advice of our doctor and do whatever she says is prudent and will continue to carry out my responsibilities regardless, but I will accept the medical advice as given, as I've done throughout.
Okay, and my follow-up is regarding this weather that we're having this week with temperatures going above 30 degrees. A lot of people, because the pools aren't open, probably going to head down to the beaches. So what's the city's plan in being proactive? Are we going to see more signage? Are we going to see bylaw officers out there ready to go and start enforcing the social distancing rules?
Well, first of all, I think I'm correct in saying that the social distancing rules may not necessarily apply under the municipal bylaw to the beaches. But having said that, the requirements that we have with regard to groups of people under a provincial order, and I think general common sense would suggest that we're going to have enforcement people out there whose job mainly has been over time to educate people and to persuade them to engage in common sense behavior with respect to the prevention of the spread of this virus. But the bottom line is that the plans will be made for all of the spaces in the vicinity, all the public spaces, to make sure that the laws that apply are enforced, and that more so than anything else people are aware of those laws, because what we found generally is when people are made aware of those laws or reminded of those laws, they comply, and they're just generally in compliance when they're reminded of good practice, leave alone what the law requires.
Okay, thank you. We'll go to Jacob Kapp now from Global News. Jacob?
Hi, Mayor Tory. I'm wondering if officials are at all concerned about a lack of public washrooms in the city. We've heard from health experts that public washrooms are essential to infectious disease prevention, especially during the COVID-19 pandemic. So I'm just wondering if there's any concern there.
Well, it's a concern to the extent that we've discussed it very regularly, including as recently as this morning. And the issue has been with all the other things that had to be done in terms of closing up public amenities and opening up public amenities and so on. The commissioning of those washrooms, which is the kind of some of the work that's done in order to get them into proper condition, was delayed. But now the work is being done to look at opening those as soon as is practical. And obviously, again, taking into account the advice of the medical officer of health. Now, there are a number of different aspects to that advice, not just the question of open or closed. And so I can only say that it's a subject we have under very active discussion as recently as today.
And given what happened at Trinity Bellwoods over the weekend, and taking into account the higher case numbers lately, do you think the province, or the city for that matter, should scale back their reopening strategies at all?
Well, I will tell you from the discussions I had with my fellow mayors today from around the GTA, that the prevailing sentiment there, which includes me, would be to make sure that we continue to proceed with caution. I think if you look at the words that were used probably 3 weeks ago, it was cautious optimism. It wasn't unbridled optimism, let's throw the doors open and do everything. I don't think anybody was saying that. And I think everybody is saying we should adopt a very cautious approach. My own take, and I'm not a medical professional, but I'm watching the things that were opened up last week, about 5 days ago, and they were some outdoor spaces and outdoor facilities. There was some relaxation of the rules as they regarded retail, but with fairly strict requirements still in place for physical distancing. And so I've turned my attention, as have most of my fellow mayors, quite frankly, to phase 2. and to saying without any equivocation or any contradiction whatsoever that we very much want to see a very cautious approach taken to deciding on when stage 2 would be proceeded with, and that we would hope that that will be based on very clearly understood criteria that the public understand as well, measurements that everybody can understand so that everybody can see that we're either getting to the stage where stage 2 would be implemented or we're not. And that is evidence, that is medical advice that we're going to get, and that is what we hope will happen with regard to stage 2, so that we're being very measured going forward, as opposed to taking any particular step with regard to what's already been done, except to exercise the kind of care that our medical professionals are telling us to exercise every single day and have been since the beginning.
Okay, thank you. We'll go to Mark McAllister now from City News. Mark?
Mayor Tory, you obviously took some time to apologize for making your way to Trinity Bellwoods on the weekend yesterday. Are you concerned at all about the backlash and the public perception as a result?
I think people respect honesty and they respect forthrightness. They respect when you move quickly to acknowledge that you've made a mistake. I'm a human being. I can tell you the tongue lashing I got from my daughter, who is a doctor who looks after COVID patients, was like very few that I've experienced in my whole life, including my experience in politics. And that caused me to move, I think, fairly quickly to say that I was sorry for making a mistake. I wasn't sorry for visiting the park because I felt it was very important that I should go, and I learned a lot when I was there. But I've said the example that I try to set, which I do every day in my job because I know it's important, will be better going forward. And I think actually from most people, the backlash, as you describe it, is minimal, because I think they appreciate it when you're honest and say you made a mistake and you move forward to do better in the days ahead, and that's exactly what I'll do.
On Friday, I did ask you about the possibility of more enforcement and more ticketing. Obviously, that question was once again raised on the weekend. Are there plans? And obviously, I think Chief Saunders mentioned it on the weekend too. Is there any change? Is there more going to be taking place as a result of what happened on the weekend in terms of enforcement?
As I've said many times, politicians, quite properly so, do not direct how the law is enforced or when it's enforced or how many people enforce it or how many tickets are given out. I can tell you what you already know, that obviously on Sunday there was a different approach taken than on Saturday. And I can tell you further, as I've said today, that there's going to be a review undertaken of all aspects of what went on in that park. And I'm sure that all of the recommendations that come from that will be taken very seriously by all of us. The law enforcement part obviously being dealt with by the bylaw officials and by the police and not by politicians.
Okay, thank you. We'll go to Francine Copen now from the Toronto Star. Francine?
Oh, hi. I'm just wondering, Mayor Tory, if you can estimate how long it might take to, for example, get circles in place in parks once you decide, if you are to decide that it's necessary.
Well, I think the parks officials and the others that were on the call this morning of our emergency command team all understood that it was necessary for us prior to next weekend at the latest, and if possible earlier, to have the recommendations of our parks professionals and our enforcement professionals, and to then proceed to make any changes they recommend as quickly as possible. So I can only say that while next weekend is an obvious objective because there are even more people available to go to parks on weekends, that the changes that are recommended, if any, would be done as soon as possible.
Thank you. That's all.
Okay, thanks, Francine. Go now to Derek Unarain from the CBC. Derek?
Thanks so much, Brad. So this first question is for Mayor Tory and for Carlton Grant. We were just wondering, why were no physical distancing tickets handed out at Bellwoods on Saturday, and what makes enforcing these crowds that large so difficult?
I don't really have a comment to offer on that. I think it's best you should ask Mr. Grant, who obviously oversees the people who hand out the tickets, as to their experience with respect to that particular day or any large crowd. So perhaps I'll turn it over to him. Carlton, please go ahead.
Okay, Derek, thanks for the question. Enforcement is very challenging. The crowds were very large. We made a lot of good adjustments so that we were better prepared on Sunday. Saturday, we really spent our time educating and didn't want to infuriate the crowd with large crowds and the number of staff that we had there. We increased our presence on Sunday. We were there early. We did a lot of awareness and sharing of information and education at the start, and that proved successful. We will continue to implement that strategy moving forward during the week and as we gear up for the weekend.
Okay, and just to follow up there, with Mayor Tory, there were mentions of measures that were being taken in regards to the heat warning. How will you guys be ensuring that physical distancing is enforced in some of these cooling centers? And is there a plan in case these centers have lots of people that show up?
I just didn't hear the last part, I'm sorry. Is there a plan?
So,
The very last
yeah,
part, I just did lost you.
Yeah, is there a plan in case, a lot of people end up showing up at the cooling centers?
Well, we have some flex in the places that are available to us. We've also lost some places due to the closure of some public buildings, but we have a number of these cooling centers that will be open should a heat alert be declared. We discussed that again this morning with a view to making sure that if there are larger numbers of people than the current number of spaces will accommodate, that we will find other places where we can put those kinds of facilities in place so they're available to people who are suffering from what is expected to be very high levels of heat.
Okay, thank you. Next is Christina Tenaglia from CP24. Christina?
Hi, thank you so much. Mayor, a number of my questions have already been addressed, so I'd like to ask you about the review that you said would take place about parks in the city. I know that there are some, you've mentioned 1,500 public parks in the city, and you said on our station today the one that had the real problem was, of course, Trinity Bellwoods, and other than that, people were social distancing. I can tell you along Lakeshore between Fort York and Stadium Road, a lot of people there along the lake, in the grassy area there, out. That's another spot. So I'm wondering, how many parks are under review?
Well, I think we're starting with the one that was a particular problem and that was a sort of a standout exception to, I think, the general good behavior of Torontonians this past weekend. I was not in every single corner of the city, of course, but I was around the city looking at different public places and seeing that people really were making a big effort to physically distance themselves. And so I can tell you that obviously one of the questions I would ask when our officials come back with some recommendations, particularly regarding Trinity Bellwoods Parks, one of the first questions I would ask, and I know a number of others, including the Medical Officer of Health and Chief Pegg would say the same thing, which is, are there other places where we should be making an effort to do something like this, or increase signage, or have more enforcement people requested to be on those sites? And so I can only say that we will be trying our very best, because we can't emphasize the importance of physical distancing as we do and then not take reasonable steps. Knowing it's a big city with 1,500 parks and many, many other public places, we can't emphasize the physical distancing and then not do anything to make sure that we educate people and try and enforce the law.
Okay, and Mayor, of course, a heat warning has been issued for the GTA, which includes Toronto. Pools aren't open right now. What about splash pads or other considerations for people to keep cool, especially those who, of course, don't have air conditioning? The idea is to remain in your home, not go to other places, like you could in the past, say, a library or a mall.
Well, I'm very sorry about the fact that splash pads and swimming pools and so on are not in operation. They are subject to a provincial order, which says that they're not to be in operation. I believe there's also a parallel municipal order. So they're just not in operation at the moment for health-related reasons. So what we have done is put in place 6 locations for publicly accessible air-conditioned places located across the city, and they will hopefully be able to accommodate, within reason, people who have reasons to be out of the heat. And as for the rest of the people that might ordinarily rely on the splash pads and the swimming pools, this is just one of many other one of many sacrifices people are making of many different kinds, and I'm sorry for that, but we have a health emergency on, and we're going to rely on the best medical advice we can get to find the day when we can open those facilities, which I can assure you will be as soon as we can agree that it's in the best interest of public health.
Okay, thank you. Next question is Mike Walker from CTV News. Mike?
Question, and most of my questions have already been asked by my colleagues. I just got one question. Piggybacking on Trinity Bellwoods, and with the hot weather this week, are there any concerns about a repeat, maybe not to the same scale, but a repeat of the large crowds gathering as the city is conducting this review plan to manage the crowds and physical distancing?
If the import of the question was, I believe that with the hot weather, are there concerns that these kinds of crowds will emerge again in that particular park during the week as opposed to the weekend? I'll say a couple of things. First of all, we're obviously going to be, keeping a close eye on that park and making sure that the kind of thing we saw happen on Saturday doesn't happen again, weekday or weekend. Over time, it has been largely confined to Saturdays that there has been evidence of larger crowds from time to time. And so while the attention will be paid to weekend days, there will be constant vigilance with respect to that park. And I think all parks, we've relied a lot during the course of the entire pandemic on people phoning us to tell us of instances where they're concerned about physical distancing, and I'm sure that will continue to be the case. The number of complaint phone calls we're getting now has dropped quite substantially. I had the numbers here somewhere, but we still get those, and if people, I think people are phoning those in a very constructive manner, not anything else, and that will help us to know where we should go to take a look and make sure people are following the rules.
Thank you.
Mike, you're still there? Your connection's pretty weak.
Good. Thank you, Brad.
Okay, thank you.
I found the number, just a matter of interest. The total number of complaints received by MLS about these matters was 89, and on gatherings 15 over the weekend. And back in the day, when this all started, we were getting hundreds of those complaints in a day. So I'm not saying there aren't areas where we need to pay attention, but I'm just saying the number of complaints we've had from people who I think are trying to be helpful in the interest of public health have substantially diminished over time, and as the weather's got better, quite frankly.
Okay, thank you. Next question is Dave Ryder from the Toronto Star. Dave?
Hi, everyone. Question for Dr. Davila. In the report going to City Council on Thursday that talks about the conditions Toronto Public Health would like to see before we move to further reopening, it says you want evidence that the provincial system for surveillance and incidence tracking can provide appropriate epidemiological data for Toronto. Can you put that in layman's terms, an idea of what exactly you want to see from the province before we have stage 2 reopening?
Yeah, so I think I can try to put that into simpler terms. And the idea is actually sharing information, having a more consistent testing strategy, and a very robust surveillance mechanism so that we can understand what's actually happening out throughout the province, what's happening in the GTA, so that we can make very informed decisions. So effectively what it is the application of the provincial framework as put forward by the province themselves with the criteria for reopening. So we're looking for very clear indication that we've got good containment and reduction of spread of the virus, to ensure that we've got good healthcare capacity, that we have public health capacity, and that we have a handle on what is happening in respect of virus activity and a full surveillance mechanism, so that we can do everything we need to do in order to allow for a safe opening and a safe environment, knowing that COVID-19 will still be in our environment as we seek to reopen.
Okay. And follow-up question is just Dr. Davila, if you could give us a big picture look at where we are now on the efforts to flatten the curve, given the latest data that you've seen.
Well, I think what we're seeing now, we have some signs about which we should be optimistic, and I think that we have made sacrifices as a city and as a province, I would dare say, and we've seen the benefits of that. We did not see our hospital system overwhelmed, as was the case in many other jurisdictions. We saw what the original projections were in respect of the potential for lives lost. And while we have lost many lives here in our city and beyond, they're certainly not at the level that they could have been, nor was that at the level that was seen in other jurisdictions. So I think that we are seeing the benefit of what we've done. However, it is clear that we are not yet out of the woods. We want to see better containment on the virus. We want to ensure that we've got the healthcare capacity, that our public health system, along with the surveillance and testing system, is robust and ready so that we're able to provide appropriate case and contact tracing, so that we can find ourselves in that circumstance where we can reopen, start to get our city back in a way that's safe and allows us to keep, an even keel. Our hospitals are still able to manage, public health is still able to manage, services can reopen, we can start to restart a number of activities, while at the same time recognizing that COVID-19 is still here. We'd like to see some treatments ideally in place, and hopefully in the months to come in the future we'll have a vaccine as well. But that's where we're at now. I think we're seeing some improvement, but we must stay the course. There is still a ways that we have to go, and we'd like to see better virus containment. So I would encourage people to continue to practice physical distancing. It is still very important. We are at a critical time.
Okay, final question is Michelle Mackey from 680 News. Michelle?
Thanks, Brad. This is for Dr. Davila. Thank you for taking my question. You mentioned the importance of self-monitoring for the thousands who attended Trinity Bellwoods on Saturday, but if there's any possibility of exposure, particularly in a high-risk scenario like what we saw in this case, why are you not recommending they also self-isolate at this point?
Well, I think at this stage of the game, one, we have to look at an outdoor environment. So we know that the risk is generally lower in an outdoor environment where you're not in a closed space. And the other thing, of course, is that there isn't a clear known exposure to a COVID-19 case. I would hazard that most people that were out there, I think odds being what they are, were likely to be healthy. But of course, we cannot be certain, and it depends on the nature of your interaction with other people. So I think it's quite appropriate, and as you've heard, this was agreed upon. I've had the opportunity to discuss this with other colleagues, including the Chief Medical Officer of Health and the Associate Chief Medical Officer of Health for the province. And we agree that given the circumstances, that it is quite appropriate to have individuals who were there at Trinity Bellwoods on Saturday to self-monitor for 14 days, to ensure that they go and get tested should they develop any symptoms of COVID-19. And we also offered some advice in respect of protecting those who might be vulnerable to COVID-19. So we've asked those individuals to stay away from those who have chronic illness or those who are older, because they are more vulnerable just in case. So these are, I think, quite reasonable precautions to take given the circumstances.
Okay, thank you. And just to follow up, something you mentioned earlier, if there is a risk of a false negative during this incubation period, is there the same risk in people with low viral loads showing minor symptoms, or perhaps those who are asymptomatic?
So there is no perfect test, right? There is absolutely no perfect test, whether we're talking about a test for COVID-19 or any other medical condition. That's why it's really important to try to focus your testing resources to those situations where you're likely to derive the most value. So you'll have heard many of us say that, look, if you get symptoms associated with COVID-19, please go and get tested. That's the time to get tested, because that's when you're likely to get the most accurate result. That being the case, I think it's really important that people realize that there is no such thing as a perfect test. So focus your testing resources where they're most valuable. And in the case of COVID-19, we're asking people that, look, if you have any of the symptoms, and there is quite a list of symptoms, ranging from sore throat and runny nose all the way to nausea, vomiting, diarrhea, and abdominal pain. But should you have any of those symptoms, it is worth going to get tested.
Okay, thank you very much, everybody. That concludes today's briefing. We'll be back here again on Wednesday, May 27th at 3:45 p.m.